Hi, I'm Dorian Warren,
And I'm Melissa Harris Perry.
and we are the co-host of the podcast System Check.
Check, check, check. The system. Check, check. The system. Check, check. The system. The system. Check, check. The system. Check, check. The system. The system. Check, check. The system. Check, check. The system. The system. Check, check. The system. Check, check. The system.
But
Right.
we're running out. We've been throwing them away at the end of the day because
Stop.
the coordination efforts are so bad. So there's a fine if you throw it away. That's like a small fine. But there's a crazy huge fine if you give it to someone who's not a 1A or like a 1B. And so people are afraid because, to prevent like Florida where you just start giving it to your friends. So people are afraid of the massive fine. So instead of just calling 911 and being like, hey, send over all your cops and EMTs, we got 20 extra vaccines, they just throw them in the trash. I really want them to get the vaccination out to people, and I need them to get COVID under control. Because until we do that, we don't have an economic health of a nation. We don't have public health in the nation. We know that Black folks are dying at disproportionate rates, and depending on where you are, it could sometimes be 3 times more than their white neighbors and white counterparts. And so I think that there needs to be PSAs coming out of the Biden administration. That's a multi-pronged approach of not just, government officials and celebrities and athletes, but really empowering grassroots organizers and people who are leaders in their own respective communities to understand what the vaccine is, to understand what COVID is doing to our communities. I mean, when I see photos of hundreds of Black people at a Bow Wow concert in Houston, you're risking your life for Bow Wow? I mean, come on. And like, let's be clear, I was never on the vaccine bandwagon. Like, I'm never an early adopter. I had an iPhone 3 up until like 2 months ago, right? So I'm not one of those people that's like first in line to get everything. But my sister is a medical professional. My sister has taken both sets of the vaccination. As a doctor in a hospital, she's like, this is the first sign of hope we've had in months. She's like, to be in a hospital and know what the code means when someone is dying from COVID. She knows what the COVID floor is. And she's like, day in and day out, hearing that code ding across the intercom has just been, her life has been incredibly stressful these past 10 months. And I know that for her, not just doctors, but people who work in the hospitals, who, work in sort of all the front worker fields, they're just stretched to the limit. And I think also just economically, there's so many people who can't get back on track until we get this under control. So like the stress factors are killing people, like their blood pressure is up, their cholesterol is high, we're immobile. Like, I don't want to, get early diabetes just because I'm not moving. So I think that they have to get COVID under control, because until that happens, we're sort of at a standstill as a nation, but especially as Black people.